common error with suturing is that people often on their first pass will like skim this epidermis layer, and they'll be just under the epidermis. Hopefully you can see that there. But then what they'll do is that they'll dig down and go quite deep on this bit, on the other side. And what that will do, we should be filmed from the other side, you can already see it happening here, is that you will send your first pass, that edge there will get pulled down to the subcut. So you'll have your epidermis lining up with your subcut or your deep dermis, and you'll have this big ridge here. What will happen when you tie the knot is that this epidermal layer will go under the dermis, and this layer will overlap on the top. And what that means is that this dermis has nothing to do, and the dermis down here is trying to join up with the subcut fat. Increases your risk of wound dehiscence once your sutures are out, and it gives a really ugly scar because this bit here will sit up for months until it eventually flattens out. And it's also prone to bleeding more because you'll have vessels in the dermis and subcutis that are just sitting there, not attached to anything. You'll have unhappy patients, and you'll be unhappy because you give patients an ugly scar. So the secret to that is, if you're going in really superficial, suturing back to front here, cruise through superficial as well. All right. Now that will give you a nice level scar, but unfortunately, because you're only grabbing the epidermis, it will probably pull through the epidermis, especially when you tie a knot. Don't know if this one will do it. No, synthetic strong. So what you're wanting to do basically is, when you're going through, you're wanting to make sure that you puncture through, try and puncture close to 90. When you feel a little pop that you're through the dermis, come up through the deep dermis. Hopefully that's showing down there. And we go deep dermis, just under the deep dermis. And then on this side here, you're wanting to go back in through the deep dermis as well. So the same sort of level. All right, and that way, when you pull your knot across, you can see here already, it will pull these surfaces flat, and you won't have one overriding the other.